Welcome to Diverse Long Island, a show focusing on issues of importance to diverse communities here on the island. I'm Michael Baldwin. Today we'll be discussing the impact of diabetes here on the island. Diabetes is a chronic disease in which the body either doesn't produce insulin or does not use insulin effectively. That causes an elevation in blood glucose. Nearly 26 million Americans have diabetes, and according to the CDC, an astounding 79 million have what's called pre-diabetes. Here to discuss this topic is Dr. Jadan Phillips, the Director of Community Medicine at Stony Brook University Medical Center, and thank you for being here, sir.
No problem. No problem.
All right, let's begin. Pleasure. So for people to understand, what is pre-diabetes?
Well, what pre-diabetes means is that you are actually in a high-risk category, which means your sugar is not actually diabetic. The number is 126 for a fasting sugar level when they check your blood. If we see it anywhere from 10 to 15 points below that, we term that a person that's higher at risk for developing diabetes. Some of the newer mandates as far as how we manage that recommends addressing that in a more aggressive fashion than it was in the past. So that person's actually started to be looked at as a diabetic in sorts as far as testing, as far as follow-up, and as far as some of the medications they may be candidates to being on.
You know, the CDC on the website says that 1/3 of Americans born today will develop diabetes in their lifetime. That is just an incredible number.
Well, I think the other thing that you have to look at is with the predominant type of diabetes, which is type 2 diabetes, one of the major comorbidities that leads into it is obesity. And unfortunately, that is something that's growing in major ways in many communities. I know many years ago, well, not many, but a few years back with Hurricane Katrina, when you saw pictures of the individuals that were affected, one of the things that impacted me, aside from the tragedy itself, was the obesity issue. I mean, I'm not trying to be funny or anything, but I'll go out and sometimes I'll just count 10 people and see how many of that 10 are obese, and a lot of times greater than 5 of them are. So again, that's one of the major risks, because what happens in type 2 diabetics, especially in your overweight population, is that they develop a resistance to insulin. So the insulin which is used to break down the sugar is not as effective, and that leads to the body having higher sugar levels, which are toxic to many different organ systems in the body.
Now, there's some other types of diabetes as well, type 1 and gestational. Just explain what those are.
Type 1 diabetes means this individual does not produce insulin or produces low levels of insulin, so that insulin shortage has to be supplemented by administering insulin on a regular basis. Most times in those individuals, you will notice that this is probably something that would have been developed in a childhood stage. So they would have a full life, unfortunately, of dealing with diabetes. Gestational diabetes is insulin resistance or higher levels of sugar that develop in pregnant women. Now, this can be isolated to the pregnancy itself and can resolve afterwards, but however, that individual would fall at a higher risk for later developing that type 2 diabetes possibly.
Do you find that in the patients that you deal with after the woman is pregnant that they do end up getting diabetes?
Not in all cases. I mean, in some cases you do see that, but again, in those situations there may be some additional risk factors that are also present, such as, again, obesity.
Now, the CDC says an estimated 7 million Americans with diabetes don't even know that they have the disease. Now, we're going to take a look at some of the symptoms of diabetes. Now, they include increased thirst, frequent urination, excessive hunger, weight loss, fatigue, blurred vision, and slow healing. When you think about those, I mean, do people see those signs normally, or when they come in? What are they saying?
Well, I think people see them all the time, and unfortunately, because they don't seem like major limiting factors for an individual, if I have to go to work and I'm a little thirsty, that's not going to stop me from going to work. So again, I think sometimes, especially now with the economic hardships, individuals prioritize on their own and sometimes put their health care on the back seat. An additional thing is the lack of access, and you have a growing population of individuals who do not have health care insurance, so they may also be exhibiting these symptoms, and they are not having any doctor or any healthcare access that they can go to have this checked out. Now, again, if you show up at the emergency room and say, hey, I'm too thirsty, again, considering the other serious cases that are present in the emergency room, that individual who's coming there may not get, or probably definitely would not get, the level of care or follow-up instruction that they need to have to follow this problem up. So again, I think that there is good reason, not saying that the good reason is going to excuse the damage that is done to the body because of the diabetes, but there are many factors that contribute to many individuals not being aware. And one last point is an individual not being aware of their own risk factors. You know, in my family, unfortunately, my parents are afflicted with diabetes. I have grandparents that were afflicted by diabetes. So I personally know that I'm at a higher risk for developing diabetes. So that makes me a little more diligent as far as monitoring myself for any symptoms, going to the doctor on a regular basis. In addition to that, also some of the other lifestyle factors that will help minimize or lower my chances of developing this disease.
In fact, we have a full screen we're going to put on the TV right now. Some of those risk factors, as you mentioned, family history can come into play. As you also mentioned, being overweight increases your risk. As is being over 40 years of age, you're also at increased risk if you have a history of cholesterol and if you have a history of high blood pressure, and leading a sedentary lifestyle also increases the risk. So of course, that word is basically just being a couch potato. Do you find lots of people just don't get enough exercise?
Well, yeah, definitely. And unfortunately, one of the things, I'm originally a Queens native, and you know, in this 5 boroughs, we have sidewalks. So walking is something that you can participate in, and it's not you stepping on the middle of 347, you know, where there's no real sidewalk. So again, I think sometimes the lack of public walkways can lead to the increased sedentary nature. And again, people are very busy today for good reason, family, jobs, etc. And you know, unfortunately, when I bring that issue up with my patients as far as trying to be more active, you know, some individuals say, I don't have time, or I have an active job. But one of the things I do say is diabetes, unfortunately, does not care if you're busy. Because again, unfortunately, it will happen or rear its ugly head on the nicest people at the most inopportune times. So again, you could either deal with it now, or you could deal with it later. And sometimes the dealing with it later is a lot more costly to the individual.
You know, I know what you're talking about there, because a friend of mine had to get his toe cut off, and because he dealt with it obviously too late. Okay, diabetes and its impact on minority communities. That's the focus of this edition of Diverse Long Island. We'll take a look at some startling statistics, and we'll tell you the steps you can take to protect your health. Welcome back to Diverse Long Island on News 12 Long Island. I'm continuing a discussion on diabetes and its impact on minority communities with Dr. Jadan Phillips, the Director of Community Medicine at Stony Brook University Medical Center. We're going to take a look at some interesting figures that show how many Long Islanders were hospitalized for short-term complications with diabetes. Doctor, short-term complications, what does that mean real quick?
Well, what it means essentially is that a simple infection like a pneumonia or a skin infection can be complicated by a person having elevated sugar levels. So that may mean that something requiring maybe overnight in the hospital turns into 2 or 3 days or more in the hospital, because in addition to combating, say, the infection, they also have to battle to get the diabetes under control.
Okay, we're going to start in Nassau County, where you have 9.2% of the black population there has had a short-term complication with diabetes. 2.5% are white, 1.2% Asians, and 1.2% Hispanic. When you see that number, those numbers, what does that mean to you?
Well, again, I think it also speaks to the issue of healthcare disparities, because, again, unfortunately, there is a significant burden with certain chronic ailments, diabetes being one of them, that afflicts African Americans much more than other populations. Not saying the other populations are not impacted by it, but unfortunately the numbers are significantly higher for African Americans, which in comparison to some of the groups are a smaller population.
Now we're going to take a look at Suffolk County. There you have 13.5% of blacks who have a short-term complication with diabetes, 4% Hispanic, 3% white, and 0.4% are Asian. Now, these are people, by the way, we got these numbers from the New York State Health Department, and these people are over the age of 18. That's a large percentage in Suffolk County, 13.5%.
Well, again, I think that disparities. I mean, again, you have to look at issues like access to care. You know, where are they able to get health care? You have to also look at, you know, one of the things that is very significant in driving how a diabetic does is literacy. You know, and unfortunately, we also fall into a category that don't do as well academically as other groups do. So therefore, if at the doctor's office I'm giving you all of these complicated, you know, terminologies and things you have to watch out for, and you, which a lot of people do, don't ask questions. They go, and they leave, and they may not be sure of what needs to be done. And then when people are not sure, a lot of times they don't do anything. And unfortunately, because you don't understand doesn't mean diabetes is going to stop progressing. Because another issue that goes into it is diet. Again, a lot of the foods that African Americans traditionally have or eat, unfortunately, a lot of them, even though they taste wonderful.
Fantastic.
Exactly. You know, because they taste wonderful, however, they are very unhealthy. And again, you know, you combine the propensity or the higher burden of obesity in our population also. So there are a couple different factors that are also playing a role here. I think one additional thing that needs to be mentioned is the existence of other health ailments with these diabetics.
All right, when we come back, we will continue our conversation with Dr. Phillips here in Diverse Long Island.
Sorry about that.
All right, welcome back to Diverse Long Island. Get some final thoughts here. Doctor, let me ask you about this. Stony Brook has a program called Stony Brook Home. Explain to people what that is.
Well, what Stony Brook Home is, it stands for Health Outreach Medical Education. It is a student-developed, student-run health clinic that the purpose of it is to provide free healthcare services to uninsured adults in Suffolk County, specifically in the Islip Terrace area.
Now, when you talk about this this group here, I mean, for people that, as you mentioned, that don't have health insurance, maybe this is their avenue so they can see a doctor, so they can get some of their needs and concerns met, right?
Definitely, definitely. Definitely. We open our doors to individuals that don't have any health care, because one of the things that was brought up in your most recent election cycle was, from a healthcare standpoint, the importance of preventive strategies in dealing with healthcare problems. And one of the things that we focus on, being that we're using students, You know, I don't want people to think that, you know, the students are doing these highly technical procedures or interventions. We're basically trying to provide people with information as far as diagnosis, you know, meaning making you aware if you do have a problem, making you aware if you're at risk for a problem, and what to do if that problem is discovered, meaning diabetes or any other chronic health ailment. And one of the things that people, even if they don't have resources, i.e. economics or health insurance, they can do, they can eat right or try to eat right as far as watching their portions, things of that nature. They can exercise. And again, you know, it's not anything, you don't need to go to LA Fitness or any type of complicated scenario. You can exercise right in your own neighborhood, in your own home. So we try to, you know, give them those types of pieces of information. In addition to that, try to pair them up with any resources that are available in the community that may be helpful for them in conquering the difficulties found with an individual with no health insurance.
Now, in a Stony Brook publication, you said our hope is that some of the approximately 30,000 or so people living within a 5 to 10 miles of the clinic, which about 1/4 are in poverty, you said, we're talking about Islip Terrace, will take advantage of the free health care education, primary care treatment. I guess that was in 2008. We're in 2011. Are people doing that?
Oh, definitely, definitely. Every clinic session is usually booked to the max. I just got an email the other day from a student from Brown University that is interested in coming and shadowing, you know, because they've heard about it via whatever avenue of our activities here on the island, and they were asking for permission to shadow to get some introduction for a potential career in healthcare. So again, I think that, you know, both the community and other individuals are finding out about our efforts. And again, you know, I just think that in order to raise our society up as a whole, we have to help those that are least fortunate. And only through that way, really, can we get to a better place. So, you know, it's a very fortunate activity for me. I'm the medical director of the clinic, and to work with these young minds that are very passionate, very enlightened, very compassionate, you know, is a very blessed opportunity for myself, because it's very easy to get yours and start to just rely and relax on that. And, you know, a lot of people are not aware of the benefits of giving back. So again, for all of those involved, it's always a love fest per se, you know, at the clinic, because again, it's a pleasure to work with each other. It's also a significant pleasure to help individuals that are least fortunate.
Just real quick and being clear, it's open to anybody? Anybody can come there? Or?
Anybody can come there. If you would like to call and make an appointment or find out, the number you could call is 631-444-2340. So that would be a number to reach to get information about how to make an appointment, because unfortunately we are not equipped to take walk-in appointments, so an individual needs to make an appointment there. So just to put people at ease, we do have board-certified physicians like myself that supervise and ultimately, you know, vet or examine any final diagnostic or management decisions made.
Doctor, thank you very much for joining us. Appreciate it very much.
Thank
All
you.
right, that's all the time we have for this edition of Diverse Long Island. Thanks again to Dr. Jadan Phillips, and thanks to you for watching. I'm Michael Baldwin. Hey, folks, enjoy your weekend.